Thank you, Madam President. Speaking to the resolution.
The senator has the floor.
The question that this constitutional amendment answers is the following. Should decisions about fundamental health care be made by politicians who do not have a medical degree, or between patients and their providers? What the American College of Obstetricians and Gynecologists says is the fundamental purpose of this amendment. Questions about whether and when to access abortion care should be removed from the political context and returned to the patient and their trusted healthcare professional. There is, in this amendment, a standard of care. It says, as the gentlelady from Arlington pointed out, that a state interest is compelling only when it is to ensure the protection of the health of an individual seeking care consistent with accepted clinical standards of practice and evidence-based medicine. So let's talk about what happens late in a pregnancy. Do you think anybody wakes up at 28 weeks and says, oh, I've changed my mind? I can assure you they don't. What happens late in pregnancy, if someone is seeking an abortion, is something has gone horribly wrong. Horribly wrong. And a decision has to be made, and a balance has to be made. What is the standard of care calling to happen? And that is a decision that should be made between the healthcare provider and the patient facing the worst news they've probably gotten in their life. What has happened late in pregnancy, and our laws and Roe and all of the federal law around what is or is not a compelling state interest reflected that, is what has happened is a balance that needs to be made by a medical professional under the standard of care. What do I need to do to save this patient's life? That won't change when we pass this resolution. What will change is the fundamental decision of who will decide healthcare, medical decisions, procedural decisions, medication decisions. Will be the patient and their provider. And all of the rhetoric around abortion up to birth won't change that. Because no one goes in to deliver and then in the middle says, oh, I've changed my mind. Nobody. Nobody. Something has gone horribly wrong. And I respect every single one of you and your belief system. But if I was that patient, I wouldn't want my doctor to have to pick up the phone and call any of you or a lawyer. I would want them to make the decision necessary in that moment to provide the best standard of care and do no harm, which is what they've sworn an oath to do. This amendment will ensure that abortion or any other reproductive health care decision will not continue to be a political football in Virginia, but that fundamental decision will be left to patients and their providers. And I ask that we pass the resolution.